I am just reading this right now as I'm filming this video, so this is blowing my mind. This is manipulation of young and vulnerable girls and women. It is not medical care. It is not informed consent. This is really making me angry. You may have heard about how dangerous the chemical abortion pills are, or you may have heard it said that they're as safe as Tylenol. AAPLOG, the American Association of Pro-Life OBGYNs, has done a lot of work helping people understand why this isn't true. But especially the way these pills are being dispensed online with no interaction with any kind of medical professional, much less a physician, these pills are much more dangerous. My name is Dr. Christina Francis. I'm a board-certified OBGYN and also CEO of AAPLOG, the American Association of Pro-Life OBGYNs. And I'm going undercover today online to show you just how easy it is to get the deadly abortion pill, mifepristone. So let's jump in. So we're going to start with Plan C, which is kind of like the Amazon of abortion pills. It's a centralized website that helps women find abortion pills no matter where they're at. So we're going to start by looking there. You can see here, it says abortion pills by mail in every state, meaning even states where abortion is illegal, like my home state of Indiana. So I'm going to search as if I'm a woman in Indiana or even a girl who is wanting to obtain abortion pills. So you can see here, they give me a long list of results of places that will provide abortion pills, including US-based clinics, as well as other online clinics and community networks. I don't really know what community networks means. I think it means a bunch of women putting pills together who have no medical experience. So that's very scary, obviously. But let's just take a look at this. You can see here on the screen, some are advertising that they will only dispense these pills to girls ages 16 and above, which remember 16 is still a minor. But others like Aid Access, which is one of the biggest suppliers of abortion pills in the world, will dispense to all ages and for pregnancies up to 14 weeks. This is well beyond the approved range by the FDA, which is 10 weeks, and they're openly advertising that they're going to dispense pills up to 14 weeks of pregnancy. So let's go on to Aid Access because, again, they are one of the biggest suppliers. I can guarantee you I'm not pregnant right now. I'm going to go on and get these pills. A man could just as easily go onto these websites. There's no immediate interaction with a physician. You're not on a telehealth visit, which many people, I think that it's telehealth when they're doing this. So anybody can go on to Aid Access. So that's where we're at right now. It says less than 14 weeks pregnant. 14 weeks is the beginning of the second trimester of pregnancy. Get pills shipped to you. The pills are the same ones you get in a clinic. They are medically very safe. Lack of informed consent here. They're not talking about risks at all. Unsure of how far along you are. We can help you figure it out. Okay, so let's go into that. Let's say that we don't know how far along we are here. All right, so they're going to ask me some questions. They say there's going to be a medical review of a medical professional that will look at my information. Then we'll have to pay $150 to get the pills. The pills are safe. They don't talk about risks, work 96 to 99% of the time. I'm going to stop here and point this out. 96 to 99% of the time is an estimate at the very early stages of pregnancy. If a woman is 13, 14 weeks pregnant here and is ordering these pills, she's got a 1 in 3 chance of needing to have a surgical completion of her abortion, potentially even an emergency surgery, 1 in 3. So that's about a 33% chance that these pills are not going to work for her. And then they go on to say that the pills will arrive in 1 to 5 days. But again, who's going to say that the woman is going to take them as soon as she gets them? So there's no guarantee that even if a woman is in the right stage of pregnancy here, that that's actually going to be when she's taking these pills. All right, so I'm going to start answering questions here and you'll see what kind of probing questions they ask me. Again, this is nothing near what someone would get if they were having an in-person visit. Are you pregnant or having a miscarriage? How would a woman know if she's having a miscarriage? Let's say a young girl, she's 13, she got on this website, she's scared that she might be pregnant because she had unprotected sex. They're telling her that, she's not sure she should take a pregnancy test or get an ultrasound to confirm whether or not she's pregnant. But it also says if you're not pregnant now, but you want to order the abortion pills, you can click on, I want to have the pills on hand in case I get pregnant in the future. So They are providing very high risk drugs to women, girls who may not even be pregnant so that they can hold on to them for a future pregnancy where they won't even go and fill out this form. So no one's screening for reasons why she shouldn't take these drugs, like certain medical conditions, anemia. No one's asking her about symptoms of ectopic pregnancy or asking how far along she is if she's got these at home and she's taking them in a future pregnancy. This is pure medical malpractice. This is what leads to women suffering severe complications and ending up in my emergency room. All right. But let's go back because now I want to tell them that actually, no, I took a pregnancy test, so I know that I'm pregnant. So I'm going to click on that. What was the outcome of the pregnancy test? The pregnancy test was positive. Is your period usually regular? So the reason they would be asking this is to try to determine, do I know for sure how far along I am based on my last period? And they're asking, do you have it once a month, anywhere from 21 to 35 days apart? That's a reasonable question, but I'm going to say no, that my periods aren't regular, because that would mean that it's very likely that I really don't know how far along I am. All right, so a warning popped up. You might be farther along in your pregnancy than you think if you had irregular periods in the last 3 months. This says if you're not sure how long you've been pregnant, you should get an ultrasound before taking abortion pills. Yet they claim ultrasounds are not necessary oftentimes. They also say that you can click on, I am sure I'm less than 14 weeks. I understand that only an ultrasound can show exactly how far along I am. So I can click that and they'll let me keep moving on. So I essentially, as a 13-year-old girl, am taking the risk on myself. How on earth do I understand the risk that I'm taking on? But they're letting me take on that risk. Did you get pregnant while breastfeeding or using birth control? Okay, let's say yes, I have an IUD in place. The reason I am going to say that is because if you have an IUD or an intrauterine device inside of your uterus as a form of birth control, and you are pregnant, you have a much higher risk of that pregnancy being an ectopic pregnancy, which is life-threatening. So I want to see how far they're going to let me go if I say I have an IUD in place. Okay, good. Warning pops up. If you get pregnant with an IUD, there's a higher risk that this is an ectopic pregnancy. They go on to explain that abortion pills don't work with ectopic pregnancy. But again, I can click on, I understand that only an ultrasound can show if I have an ectopic pregnancy. So I'm just going to click on that. Look at that. I can keep going to order these pills. Again, this should be a hard stop. If somebody says they have an IUD in place, it should absolutely be a hard stop where they say, we will not give you these pills because you have too high of a risk of having an ectopic pregnancy. You must be evaluated with an ultrasound and provide us with those ultrasound results before we will send you these pills. They're not giving me a hard stop. They're making the woman who has no one counseling her take all the risk upon herself, and they're letting me keep moving through here to order these pills. Okay. Enter the first day of your last period. If you're not sure, make your best guess. If you really don't know, we recommend you get an ultrasound. Okay, I'm just gonna pick a day. I'm just gonna say November, and let's just say the 10th. Okay, that means I'm 12 weeks pregnant. What if because remember, they've already told me that I can't get these if I'm farther than 14 weeks along. So what if my period my last period was September 10th? You're 20 weeks and 6 days pregnant. I'm going to see that and be like, I really want an abortion. I don't care how far along I am. So let me just change the date so that I get back under that cutoff that they gave me. So now I'm going to go back to November and make myself 12 weeks pregnant, even though I could very well be 20 weeks pregnant. And this is really important, actually, because just basing how far along a woman is in her pregnancy off of her last period, we know is not accurate. Ask any OBGYN that you know, they'll tell you this. And the data bears it out as well. Even AAPLOG, the American College of OBGYN, says that up to nearly half of women will be wrong about how far along they are just based on their last period. And that any pregnancy that doesn't have an ultrasound prior to 22 weeks should be considered suboptimally dated, meaning you can't be sure that their dates are correct if they don't have an ultrasound. So this is why this part is so important. All right, now they're asking about my age. Are they asking for an ID to tell them how old I am? No. Are they asking for an ID to tell them even that I'm a woman? No. Okay, and we know that men get these drugs and use them to force abortions on their partners. All right, I'm going to say that I'm younger than 16 and see what they say. because it says we support people of all ages. So I'm younger than 16. Are they asking me, are you 11? Did someone abuse you and that's why you're pregnant? Did someone rape you? Which as physicians, if a young girl comes in pregnant, that is one of the first things we ask is who it was that got her pregnant so that we can know, is this a sexual abuse situation? Because oftentimes it is in young girls. Nope, they're not asking about that. All they say is, it is important to us that you feel safe and supported throughout this process. Do you have anyone you can trust helping you? All right, I'll say yes. Would you like more information or emotional support? Have you experienced rape, domestic violence, or coercion? You know what? As medical professionals, we are mandatory reporters when we see a patient who has been sexually abused. Who's the mandatory reporter in this situation with this young girl who's been sexually abused potentially and now is pregnant? No one. All they do is say, no one should force you to continue a pregnancy. What if her abuser is the one who's online ordering these pills, or is the one standing right next to her holding a gun to her head, making her order these pills? There's no way that these people know this. So I'm going to say I don't want more information or any emotional support. They're letting me keep going. Do you have any of the following medical conditions? Chronic adrenal failure, a bleeding disorder, inherited porphyrias, or any allergy to misoprostol or mifepristone? So these are, in fact, very important medical questions that a physician would ask before dispensing this drug. But again, if a woman is on here and she knows that if she says yes to any of these things, she's not going to get the drugs for the abortion that she feels like she needs, she's going to lie about it. And there's not going to be anyone actually looking at her medical records. Or she may have no idea if she has one of these things. They're not asking her about family history or any of the other things that we would do as physicians to try to figure this out. All right, let me just try to say yes that I have one of these just to see what happens. It does say it is not safe to take abortion pills with your health condition. And it says it gives information where someone could find an actual clinic. Okay, so this did give me a hard stop. That's good at least. But again, let's say I'm a scared young girl who really wants this abortion and I get this. What am I going to do? I'm going to hit back. I'm just going to change my answer. And now I'm going to say no. Okay? It didn't say, you just changed your answer. Why did you do that? No, it's letting me continue to go. Do you have any other health conditions? I'm going to say yes. Please tell us about your health condition. Abortion pills can be used safely with almost all health conditions. If we need extra info, our abortion providers will contact you. I'm going to say that I have anemia, which is a low blood count. So these drugs should not be given because of the amount of bleeding that they cause. Do you take any regular prescription medications? I'm going to say yes. And it does say which medication do you take. I'm just going to say blood pressure medicine and just see what they say. Do you take any blood thinning medications? What happens if I say yes? Okay. If you are on blood thinners, you have a higher risk of very heavy bleeding, which is exceedingly true. Do they say, we can't get these to you? No. Do you understand that if you use blood thinners, you will have a higher risk of heavy bleeding and you should be near a medical facility when taking the pills? Again, this should be a hard stop. Women on blood thinners could die from massive hemorrhage if they take these drugs, especially if they're far along in their pregnancy. But I can say, yes, I understand that, and I can still continue to move along. Do you have any allergies to any medications? I'm just going to say no to that. Have you ever had a cesarean section or other surgery of the uterus or womb? I'm going to say yes. How many C-sections have you had? And when was the last one? And again, remember, I've said that I'm less than 16. So I'm going to put really inconsistent answers in here and we'll just see if I'm able to get the pills. So I'm going to say that I have had 3 C-sections and that my last one was 2 years ago. I doubt that there's a less than 16-year-old out there who's had 3 C-sections, but okay, do you understand that your risk of taking abortion pills after having a C-section, you should be near a hospital when taking the pills? Yes. Okay. Are they finding out, am I near a hospital? Have you ever had an ectopic pregnancy or pregnancy outside of the uterus? Remember, I've already told them that I have an IUD in, so I'm already at risk for ectopic pregnancy because of that. I'm going to say, yes, I have had an ectopic pregnancy. When did you have an ectopic pregnancy? Because there's a higher chance. I'm going to say 1 year ago. Do you understand the risks of taking abortion pills during an ectopic pregnancy? Yes, but I want to get the pills anyways, and they are going to let me. Did you request or order another set of abortion pills in the past 4 months? I'm going to say no. We do not judge you, they say, if you did. We just want to make sure we understand your situation. That's very kind of them, especially since they're not giving me any medical care whatsoever. I identify as, this is very helpful, female, male, trans man, or non-binary, female, but my name is also a man's name. Let's just say I identify as male. Let's see what they say, even though we know only women can get pregnant. We are sorry, but we cannot provide services to cisgender men. We can only provide the service to the people who can get pregnant. Okay, so if I'm a man and an abuser and I'm ordering these and I picked the wrong thing, what do? I just go back. I identify as female. Okay, here's the patient agreement. So this is required by the REMS, the risk evaluation mitigation strategy that is in place per the FDA. This is the only piece of the REMS that's left, is that the patient has to get this patient agreement. I have decided to take mifepristone and misoprostol and will follow my provider's advice. It's saying that I know that I'll take mifepristone on the first day and misoprostol 24 to 48 hours later. My healthcare provider has talked to me about the risks, including heavy bleeding and infection. Okay, nowhere yet did they say anything about the risk of infection, which is severe, and that's why it has a black box warning on mifepristone. So this is making me agree that somebody has talked to me about that risk. No one has talked to me yet about that risk. And who is my healthcare provider? I'm on a website. I haven't talked to anyone. I haven't received anyone's name or contact information. I have no healthcare provider in this situation. Says I will contact the clinic, office, or provider right away if in the days after treatment I have any of these things: fever, heavy bleeding, severe stomach pain, any of these things. Again, who is the clinic I'm supposed to contact? Which office? Which provider? There's no one. I'm left alone to go to my emergency room if I have any of these things. I should follow up with my healthcare provider. Again, who? What if this girl doesn't have a doctor that she can go to? I know that in some cases the treatment will not work. This happens in about 2 to 7 out of 100 women who use this treatment. This is interesting. So 2 to 7 out of 100 would be 2 to 7% failure rate, when they said in the beginning 96 to 99% success rate. So here their numbers are contradicting themselves. If my pregnancy continues after treatment, I will talk with my provider about a surgical procedure. Again, what provider? There's no provider. I know I sound like a broken record, but this is so frustrating to me. Okay, let's go through. Agreement using aid access service. I agree with the website's rules. I agree to share this information with the medical team. I agree my data can be used for research. I understand I will get emails about my care, and I agree to this. I understand my pregnancy is dangerous to my health. I am just reading this right now as I'm filming this video, so this is blowing my mind. They did not talk about any of the risks other than bleeding of mifepristone, which are significant. And yet they want me to agree to understand that my pregnancy right now is dangerous to my health. This is manipulation of young and vulnerable girls and women. It is not medical care. It is not informed consent. This is really making me angry. Okay, I know I have the right to get care, but in rare cases, some states may take legal action. Okay, again, not true. There's not a single state in this country that criminalizes women for taking abortion pills. Aid access could be held criminally liable, yes, and they should be. I know pregnancy can be risky, and ending an early pregnancy or treating a miscarriage is much safer than giving birth. This is pure lies. It is not based on any factual medical information, and these people should be held accountable for lying to women and vulnerable girls. Likely what they're basing this off of is a study that has been well debunked by Dr. Daniel Grossman that claimed that abortion is 14 times safer than childbirth. I would encourage anyone watching this to go to the website of the Charlotte Lozier Institute or our website, AAPLOG.org. In both places, you can find documents that talk about why this study is actually false. They're comparing apples to oranges. Actually, at about 18 weeks of pregnancy, abortion becomes significantly more dangerous than childbirth. But again, this is pure lies. And nowhere have they talked about the real risks associated with mifepristone, which we know are significant. Almost 1 in 9 women will likely suffer a severe complication. Where is that as part of informed consent? Instead, all they're doing is shoving their agenda down this girl's throat while she's in a very vulnerable situation and not giving her informed consent. All right, I will take the medicines near a place with basic medical care. Oh, gee, is that really what women deserve when it comes to healthcare? Basic medical care? If a woman is suffering complications, she needs to be close to a place that has a lot of blood for her potential blood transfusion, that has in-house gynecologic services. So if she needs an emergency surgery, she can get that. First of all, how do they know that she's anywhere close to that? She could be 3 hours away from that and die before she gets there. But also saying that she needs to be near a place with basic medical care. If you show up to your local urgent care hemorrhaging from these drugs, they will be able to do nothing for you. This is infuriating. It is not the kind of care that any woman in this country, or anywhere else for that matter, deserves. All right, prepare for taking your abortion pills. Don't take them alone. Wow, that's good advice. Even though most girls will be taking these alone. Just as when you give birth, you need to be within 60 minutes of a hospital or other place that can give basic medical care. Nothing about the amount of blood that I will have, what's normal, what's not normal, when do I decide to go to the hospital, abortion. And then it says, if you are worried about getting in trouble for taking abortion pills, you can just tell the medical staff that you are having a miscarriage. Abortion and miscarriage look exactly the same medically, and there is no way for medical staff to tell that you've taken abortion pills. This is the only instance in where I have seen supposed medical professionals tell a patient to lie to another medical professional. And there's actually a study out there that says that this will worsen her outcomes, that women who had a diagnosis code of a miscarriage when actually they were having a chemical abortion actually had a higher rate of hospitalization. So it does matter for the physicians like me who are called down to the emergency room to take care of women experiencing these complications. We need to know exactly what's going on with her, not because we're going to call the police on her, but because we need to be able to take good care of her. Please write your full name here. This has to be the name of the person who will use the tablets. Now, I am going to use a different name because I want to see how easy it is to get these pills sent to me. So I'm going to use an abbreviation of my name, and let's see what happens there. Okay, now I have to give my correct name and address. I'm going to pick my birth date, but in 2013. So that would make me, or I'll do 2012. That would make me 13 right now. Okay, so it says they received my request. Here's what will happen next. They will email me. Healthcare provider will review my information. If they need more information, they'll contact me. If everything looks okay, they'll email me instructions to pay. So we'll update you on what comes from Aid Access. The pharmacy will send out the medication to you within 1 day, but it can take 1 to 5 days. Each package will contain 1 mifepristone tablet and 12 misoprostol tablets. We'll give you an update on this one as soon as I hear from them. So within like 2 minutes of submitting the form on Aid Access, I got an email, which we will show you, and it said that all I had to do was confirm that that was the right address to send this to, and then pay my $150. And then it says, this payment includes everything. Email us back with a copy of the payment confirmation or a screenshot of the payment completion webpage. And then after I send that, it says that I will be prescribed the pills. It doesn't say anything about if you pay and then our doctors determine you can't take these pills, you'll get your money back. It doesn't say that there's anybody reviewed any of the things that I did. So
you're a 13-year-old who's had 3 C-sections with an IUD, with a risk of ectopic pregnancy, who also has taking blood thinners
and on blood pressure medication, and has anemia. Yes.
And they prescribed you the pills.
Yes. So, hopefully, this was helpful as I explained some of the real dangers with the way that these drugs can be obtained online. This is, again, not only deadly for the preborn children whose lives are lost as a result of these drugs, but also extremely dangerous for young girls and women who are either ordering these themselves when they're in a very vulnerable situation where they don't know what else to do, or abusers, as we've seen, get online and order these drugs and force them onto their wives, their girlfriends, and force abortions that are not wanted. This needs to end. There's no reason this should be happening in the United States of America. And it's time for the FDA to do its job and reverse course on the reckless removal of the safeguards that were put into place around this dangerous drug so that women and girls can be protected and more preborn children's lives can be saved.